You've probably heard people joke about size as if it's something fixed for life. But what if I told you that certain medical conditions can actually change it, for real, over time? Imagine waking up one morning looking down and realizing something is different. Not in your head, not an illusion, but a genuine, physical change. It sounds shocking, maybe even impossible, yet science says it's not only possible, it's happening to thousands of men right now without them even realizing. Today, we're diving deep into the surprising, sometimes uncomfortable, but absolutely crucial truth. The medical conditions that can shrink, or in rare cases enlarge, the penis over time. And trust me, by the end, you'll want to know exactly what to look out for. Before we start, let's make one thing clear. Natural changes in the body happen to everyone as we age. But when we're talking about noticeable changes in penis size, there's often something more at play. The good news? Understanding these conditions early can prevent permanent changes. The bad news? Most men ignore the signs until it's too late. So let's go step by step with real medical science, relatable stories, and some eye-opening facts you've probably never heard before. 1. Peyronie's disease, the silent curve that can steal length. Picture this. A 45-year-old man notices his erections are bending in one direction. At first, he laughs it off, but over the months, it becomes painful and shorter. This is Peyronie's disease, a buildup of scar tissue inside the penis that causes curvature and, in many cases, loss of length. It's not rare. Some studies estimate it affects up to 1 in 10 men. The scary part? Many ignore it, thinking it's just age. But without treatment, the scar tissue can worsen, leading to permanent shortening. 2. Obesity. It's not just about the belly. When men gain significant weight, especially around the lower abdomen, fat can build up in the pubic area. This creates what's known as a buried penis effect. The shaft isn't actually shrinking, but it appears smaller because part of it is hidden under fat tissue. One man described it perfectly. I lost 40 pounds and suddenly I gained an inch back. It's a simple but powerful reminder. Sometimes what you see isn't the whole picture. 3. Prostate surgery, the unexpected side effect. Prostate cancer is a battle no man wants to face. But for those who undergo radical prostatectomy, surgical removal of the prostate, there's often a surprising consequence, a noticeable reduction in penis length. Researchers believe this is due to nerve and tissue changes after surgery, as well as scarring. It's not guaranteed to happen, but when it does, it can be permanent. That's why doctors stress pelvic rehabilitation and early intervention. Suspense build. Now, you might be wondering, if this is happening to so many men, why isn't anyone talking about it? Well, here's the truth. It's a mix of embarrassment, stigma, and the fact that these changes often happen gradually, so men don't connect them to a medical condition until years later. 4. Low testosterone, the hormone behind the scenes. Testosterone isn't just about muscle or mood, it plays a role in maintaining penile tissue health. Chronically low testosterone can cause the spongy tissue inside the penis to lose elasticity. Over time, this can result in less full erections and a slightly smaller appearance, even when aroused. 5. Scar tissue from trauma, a painful memory. An injury during sports, vigorous sex, or even a freak accident can cause micro tears in penile tissue. If they heal poorly, scar tissue can form, much like Peyronie's disease, leading to shortening or curvature. And this brings us to one of the most surprising, and in some ways most preventable, reasons of all. 6. Chronic inflammation and autoimmune disorders. Conditions like scleroderma or certain forms of arthritis don't just attack joints. They can cause fibrosis, hardening, in tissues all over the body, including the penis. The result? Gradual stiffening of tissue and reduced length. One patient recalled, "It wasn't painful at first, but I noticed less flexibility, like the tissue was tighter." 7. Erectile dysfunction left untreated. Many people see ED as just a bedroom issue, but when erections aren't happening regularly, the penile tissue doesn't get the oxygen and blood flow it needs. Over time, This can cause the smooth muscle to be replaced by less elastic tissue, leading to a real, measurable reduction in size. 8. Smoking, the everyday habit that steals size. Here's a wake-up call. Smoking damages blood vessels throughout the body, and the penis relies heavily on healthy blood flow. Long-term smokers are more prone to ED and tissue shrinkage because of reduced oxygen supply. One study even linked heavy smoking to up to a 1 centimeter reduction in length over decades. Example for relatability. Think of it like a garden hose. If water pressure is weak and the hose gets kinks over time, it won't expand fully when you turn on the tap. The same principle applies to blood vessels in the penis. 9. Diabetes, the double attack. Diabetes damages nerves and blood vessels, both critical for erections. Over years of uncontrolled diabetes, reduced blood flow and nerve signaling can lead to smaller, less firm erections and eventual tissue changes. 10. Long-term stress and cortisol overload. It sounds far-fetched, but chronic stress floods the body with cortisol, which can lower testosterone, worsen ED, and contribute to weight gain. A triple threat for penile health. It's not instant, but the slow erosion of function and appearance is real. Curiosity build. Now here's where it gets interesting. Some of these changes can be slowed, stopped, or even reversed if caught early. But the key lies in knowing the warning signs and acting before it's too late. Preventive and recovery tips. Practical takeaway. Maintain healthy weight. Keep testosterone in balance. Don't ignore curvature or pain. Quit smoking. Manage chronic illnesses aggressively. Stay sexually active for tissue health. If you've learned something today that made you stop and think, remember this. Awareness is your first defense. Talk to your doctor, share this information, and don't let embarrassment stop you from taking action. Your health, and yes, your size, are worth protecting. If you found this video valuable, hit that subscribe button, give it a like, and drop a comment about which fact surprised you the most. You might just help another man out there who had no idea this was even possible.